When I answered the phone and I heard her voice, I feel like I instinctively knew right away what she was gonna say. And it felt like all the air got sucked out of me. Dr. Salome had called me to tell me that I had breast cancer. I remember I didn't cry right away. I was just in shock. It was just so surreal. I was 40 years old. I have no significant family history of breast cancer or any cancer at all. It didn't seem possible.
It was a very small area that I'm sure she'll tell you she couldn't feel. By the time she would have felt this, I'm not sure how advanced it would have been. My worry is that would have been spread throughout her body. So on that first mammogram, it was just a shade different. It was just a subtle finding, but her subsequent workup found that cancer.
My husband was amazing. I know he was extremely nervous, and I'm sure, when you get a diagnosis like this, your brain goes to the darkest place. What happens if my wife dies through this? What happens? And I'm gonna be a single dad with 3 little kids. But he was fantastic and told me continuously, you got this, you can do this.
It was a lot. First, you're just learning about what you're dealing with, and then you need to make some hard choices without necessarily knowing all of the information yet. It feels kind of like you're drowning at that point and you don't really know how to ask for help. But Avera did a great job of educating us so that we could make the best decision possible at the time.
I can't say enough good things about Dr. Bryan. She was so compassionate, so caring. She talked through all of my questions, and I asked them probably 2 or 3 times because you're so overwhelmed with information. And she explained everything so thoroughly to me.
We're the first ones really sitting down and having the conversation of what does this mean? How are we going to take care of you? What type of treatment will you need?
So we went through all of the options that were in front of me, and then we lined up what was next.
All breast cancer, and really all cancers nowadays, are a team approach. None of us do this by ourselves.
Sometimes in our tumor board, we'll discuss patients and what options are available to give them the best kind of integrated cancer care.
What you need is a team together that can actually help make the best treatment for you to lower the risk for the future.
And that means that each person's cancer treatment plan is very individual. We've had everyone in a group sitting together, talking about it, coming up with the best plan for that person based on exactly what their tumor looked like.
I feel like as a patient, it's very reassuring. You get all of these people who are experts in their field, and they collaborate together to come up with the best care for their patient. With the genetic counselor, I talked with Kayla York. She gathers all the information about your family, who has had breast cancer along paternal line and maternal line. And for me, there was really none on either side. At that point, they do a blood test, so very easy. Just take some blood, and then I think it was about a week later, she got my results and sat down with me.
Especially for a woman Carrie's age at 40, where this is her first mammogram, this was not expected. It can also start to help answer the question of why did this happen? So we sent off genetic testing, and it found a mutation in a gene called NBN, which is a little bit more rare gene related to an increased risk for breast cancer. It can't tell us it will happen, it can't tell us it won't happen, but it can help us with how high of a risk are we dealing with for which types of cancer.
I have a 30 to 60% chance of getting breast cancer. So that's a big window there, but obviously it did affect me, and I did get breast cancer by the time I was 40.
Having a patient understand what their results mean for them and being able to make decisions about them, and having a resource to ask those questions to just gives one more person on their team that can really help them understand what's going on, as well as help the providers know what the patient is saying and what those results mean. And we talked about the screening options if she chose a lumpectomy. We talked a lot about surgery options if she chose a double mastectomy. We talked about risk numbers in each instance. It's also a very personal decision because this is a very visual part of being a woman. So it's having the conversation around what is their comfort level with it, how high of a risk are they comfortable with in regards to a second breast cancer. For some women, the thought that there's even any chance of this happening again is enough to think about a double mastectomy. And it was really the conversation between us that got us to the point of her choosing the double mastectomy.
When I got the recommendation for a double mastectomy, it was overwhelming. That's a huge surgery. You're removing all of your breast tissue. And as a mom who breastfed all 3 of my children, that was a hard decision to let that go. In my mind, I just thought, I don't want to be this patient ever again in my life. So I want to know that I did everything that I could do to prevent reoccurrence within my power. And a double mastectomy was part of that. So when we did the double mastectomy, it was originally supposed to be about a 4-hour surgery. And when they do that, they do something called a sentinel node biopsy. So what that looks like is they inject some dye before the mastectomy, and then they go in there and they find those first 2 lymph nodes. It's like a highway. And if it's in number 1, number 2, and they kind of go down the chain. It's not going to be in lymph node number 6 if it's not in number 1. So what they do is they test those first 2 to see if there's any cancer present in those 2.
Carrie was in surgery, and the time was going longer and longer, and I was in that waiting room waiting and knowing that probably wasn't a great sign. Dr. Bryan came in, explained kind of what was going on, that it had traveled further than expected.
That's always a little bit of a letdown when you get positive lymph nodes, especially in a really young patient. And so you know that that's going to be a difficult conversation.
Very difficult to hear that at the time, grasping for some control over the situation, and really I had none. It doesn't always go to plan, right?
And then they had their panel, their team that sat down and talked, okay, what do we do with this? And initially my tumor was stage 1, grade 1. So stage 1 being it was small, and then grade 1 meaning the cells grow slowly. So as Dr. Jones had told me, that's a red herring because it looks like it's not that bad, but it actually is very concerning to us that you had this tiny tumor that I couldn't even feel on self-exam. And it figured out how to spread before it figured out how to grow.
Based on her age and the tumor and the positive lymph nodes, our medical oncology colleagues felt it was best to move forward with chemotherapy afterwards as well.
I remember the appointment where Dr. Jones told me I had to get chemo, and I was so angry at him. And I remember telling him, I'm so sorry, I'm not angry at you. And he's like, I can handle it, it's okay. But he said, Carrie, if you have even 1 cell of this cancer left in your body, it's so aggressive, we have to kill it. And I have 3 little kids, so I said, okay, we will do whatever needs to be done. Whatever your recommendation is, we'll do it. And so we proceeded with chemo.
It can be frustrating to find out you need other things such as radiation or chemotherapy. The difference is that her risk level changed. So the situation where we thought we can just give pills and we can see how she does over several years changed into this is a high risk scenario and we need to provide chemotherapy. But in the long run, we want our patients to be alive and healthy, and if we can lower our risk as much as possible, we will do that.
It felt like I was injecting poison into my body, and I knew that the nature of chemo was going to make me feel pretty bad.
She wanted to keep some sense of herself, some sense of identity, so many things changing. She began researching this cold cap process. The more she researched it and talked to me, the more I got to know about it.
He watched every YouTube video out there, and he did it. Every chemo appointment he was with me, he did my cold capping, and it went for hours after chemo, so he did that throughout the day for me, and he was just wonderful.
It was a pretty amazing thing, especially for Carrie, who got to keep so much of her hair. And we built up a routine that we kind of perfected over the first couple, and it gave me a chance to help and be there. And I wanted to be there for those treatments. And it helped her to focus on the fight that she needed to fight.
I didn't want to be in bed. I didn't want to be tired. I didn't want to feel bad. So I went into Like I said, I went into this with a very, I'm going to fight this, almost like an angry mentality. Like, you are not going to change the person that I am. And so I wanted to do the things that were normal. I wanted to cook with my kids. I wanted to go on walks. I wanted to, just play with them and have movie nights. And I didn't want to be in bed.
I remember when Carrie and all my patients received their last round of chemotherapy. It's a celebration and a big milestone because they made it through another step of treatment.
Chemo was done. I got to get my port out, which was fantastic, and then Figura put in my permanent implants.
I think reconstruction can give people a path back to normalcy. So certainly the scars are there, the memories are there, but if a woman can put on her clothing that she wore before her diagnosis, if she can hug people with confidence, if she can go to sleep at night feeling like she did before, I think that's wonderful.
Reconstruction is very different. It looks different than elective breast augmentation. So initially, when I had the double mastectomy, Figura likes to do what's called expanders. So it looks like implants, but they just have air in them, and then they fill them with saline. So I had those in from May of 2021 until January of 2022. And it was a much easier surgery than the mastectomy. My healing time was much shorter. Dr. Figura is wonderful. I just love her. She's a boss in her field. What I was expecting was nowhere near the expectations she had for herself.
It's rewarding. It brings some pressure because the stakes are high. We become very close with each patient. They're special individuals that, obviously I want to have the most fantastic outcome so they can get back to living. That's what all of this cancer care is about, is living and enjoying your life. It's just so rewarding to be that touch point for someone that they can say, oh wow, I had a great outcome and I'm happy with the reconstruction and I'm, back to doing everything that I wanted to do. It feels really good.
Here I am, months later, and I'm very comfortable. I've gotten used to the numbness in places, and I've gotten used to the feel of them and everything that goes along with that, and just adapting to my new normal.
Carrie touched so many parts of our team. And then Carrie will continue to follow with us because there is a risk of recurrence, and that's something that we want to be on top of and making sure she feels comfortable with her screening, as do we.
If Carrie would not have had this mammogram, she would have had a significantly different outcome.
Get your mammogram by the time you turn 40. Getting this mammogram saved my life. I had 3 different doctors tell me that because it was in my lymph nodes, had I waited even a year, this could have been everywhere, and this would be a much darker story. So my mammogram absolutely saved my life, and I would tell every woman that I encounter to get your mammogram.